All right. Hi, everyone. My name is Evie. I'm one of the associate clinicians here at Holistic. And I just want to do a quick introduction to an introduction of Lynn Hyde, who is a really amazing Seattle-based body piercer. And they're going to present on the overlap of non-suicidal self-injury and body modification today. So, Lynn, if you feel comfortable to get started, let's go.
Awesome. Welcome. This is Body Modification as Healing. We're going to kind of talk about, as Evie said, that overlap of non-suicidal self-injury and body modification. So a brief disclaimer before we get started. There is a really strong content warning in this class for discussions of self-harm, suicide, mental health, and potentially other triggering conversations. There also may be some imagery in this class people find graphic. We're going to take a look at some practices that we may not be familiar with here in the West, or may have strong visceral responses to. So please don't hesitate to pause or step out if you need to. The views expressed in this presentation are my own as a professional piercer, a trauma-informed care worker, and a person who has struggled with mental health myself. These views do not reflect any professional organization or holistic child and family, nor are they a replacement for professional help. And of course, if your loved one is struggling, please contact the professionals about it. Now, a little bit about me. My name is Lynn. I use they, them pronouns. I have been piercing professionally for 14 years, and I am the founder of Nexus Body Arts here in Seattle. I've been an Association of Professional Piercers member for 7 years, and I am a professional educator in my field. One of the things I teach about is trauma-informed care for piercers, which I think is a cool overlap. And I would personally self-describe myself as a self-harmer. I had a history of self-injurious behaviors when I was very young, and while I no longer feel that it is something I struggle with, it is something I still practice. And we're going to talk a little bit about what that looks like in this class. Um, a second disclaimer. The very first thing we're going to do today is try to step out of a Western lens. Western culture and especially Western therapy spaces often pathologize body modification and self-injurious behavior. And today we're going to be looking at some cultures where these things are not considered negative, they're not considered harmful, and they are in fact important practices in that culture. And so I just ask with some of the stuff we're looking at and talking about that we try to actively take ourselves out of that Western lens and just be open to what we can learn from other places and other viewpoints. Now we're going to start a little remedial, obviously, because I'm talking to a bunch of therapists, but I just have a couple of definitions I want to review before we get into the meat of things. All of these definitions are taken from Merriam-Webster. These are like the main accepted definitions for these terms. And this will be important a little bit later, but self-harm, deliberate injury to oneself, typically a manifestation of a mental condition. Non-suicidal self-injury, or NISI, because that's kind of a mouthful, is the deliberate and direct destruction of one's own body, such as cutting, burning, or hitting without any suicidal intent. It is a way to cope with intense emotional pain, relieve stress, punish oneself, or feel something when feeling emotionally numb. The behavior causes significant distress or impairment and is not socially sanctioned. It differs from self-harm with suicidal intent. And then my last definition, coping skill. A strategy used to manage stress, difficult emotions, and challenging situations that can involve relaxation techniques like deep breathing or meditation, distraction through hobbies or exercise, processing feelings by talking to someone or journaling, and taking care of your physical health. The right skills are often personal, so it can be helpful to experiment and find what works best for you. Three things that I think we're all fairly familiar with. And now that we've read some definitions, just to make sure we're all familiar, we're going to talk about a couple things and say whether or not they are coping skills or self-harm. I know Evie is watching the chat if you want to put it in chat or just speak. But starting out with eating comfort food after a stressful day. Is this a coping skill or self-harm? Anyone? No one.
I'm seeing coping. Two people said that's
Coping
coping
skill.
behavior.
Yeah, I think that's definitely a coping skill. Now, if someone goes home and their comfort food after a stressful day is four large stuffed crust pizzas, and they're doing it every day, most days for months on end, Is that still a coping skill?
I see someone says that it's determined by the person and their situation.
Yes, I agree. I think there's very little black and white in it, but it depends on what we're seeing. That could maybe fall into self-harm, could maybe be someone with disordered eating that we need to address. It could also maybe be the only thing that makes sense in their situation. A 3-hour workout after getting bad news, coping skill or self-harm.
I'm seeing people are also saying coping.
I agree. I think as someone who loves to work out, I think it could be. But I think as someone who has struggled with disordered eating, if I'm barely eating any food during the day and I'm getting on the treadmill for 3 hours a day, every day, and consuming like 400 calories because I feel like I have to earn food or I feel like I have to have that treadmill time. I have to be in the gym and not thinking about food. It can also cross into self-harm.
Yeah, I see some folks in the chat who are wanting to be very nuanced about this, that it could be both
Yes.
depending on the situation.
Yes. So, getting your nipples pierced after a breakout, coping skill or self-harm.
Hmm, coping,
A lot of
coping.
times, absolutely coping. We do a lot of post-breakup nipple piercings, actually. I like literally talk about it with clients all the time. The majority of the time, it's people who are like, yeah, my partner said that I wasn't allowed to get these. So like now we're broken up and I'm getting them. And I'm like, yes, bodily autonomy. It is your body. You get to do what you want. Very much a coping skill. However, I have had clients come in and tell me that they're getting them pierced after a breakup because their partner thought piercings were sexy and they want to try and get them back and they want to be this person that their partner wanted them to be. And then I have this interesting place where, as a service provider, I'm not going to always necessarily decline. It's very rare that I would decline piercing, but maybe now I have to have a conversation with them that they're beautiful however they are, and that if this isn't a piercing that they really want from themselves, maybe they need to think about that. So sometimes, very rarely, but sometimes there's situations where I find myself going, I don't know if this client is doing this in this healthy way or not. Now, getting my partner's name tattooed on me after a fight, coping skill or self-harm. I know, I know.
So going back to the previous one, we had someone say, I kind of think both slash one and the same, like self-harm as a coping skill, but I might be answering this very autistically. Someone else said it depends, like always. Someone else said,
Yeah.
I think all are likely attempted coping. It depends on the person and context. You can tell you're talking to a bunch of mental health professionals
Yes,
today. We need to do
yes,
some investigation, someone said.
yes. Everyone's being very nuanced with it. And so now our last one that I'm really interested in seeing people's thoughts on, cutting yourself during a breakdown, coping skill or self-harm.
Depends both self-harm as a way of coping.
I love that we're already getting depends because we're already on the wavelength I'm hoping to get people on, which is that there's really no black and white. And it's very dependent on the situation. And we cannot easily put any of these things in a singular category because there is so much fluidity. And it really does depend on the situation that someone is in. So today we're going to really focus on this fluidity and on these gray areas in behaviors where we're dancing that line between coping skill and self-harm, which is something that can be scary to talk about, but we're gonna face head on today. Oh, so we're gonna. One of my favorite authors, Armando Favazza, who is the author of um, oh, sorry, had a brain moment there. Author of Bodies Under Siege says if ritual self-mutilation serves a therapeutic purpose for some cultural groups, then perhaps it serves the same purpose for some mentally ill persons. Could it possibly be true that at least some forms of self-mutilation represent an attempt at self-healing? So when we think about the processing of pain and pain as a cultural norm and self-healing, there is actually a lot of really cool cultures that practice pain ritual. in ways that we sort of don't really see in Western spaces. So first, we're going to look over here. In Hindi cultures, Thai Pusam is probably the most notable example of this. This is a really beautiful Hindi festival honoring Lord Murugan and his defeat over evil and the triumph of the powers of good with his veil or his spear. And there are spectacular displays of devotion and pain penance, which can include bearing a kavadi, which is a large metal structure with big skewers that go into the skin, spears through the cheeks, piercings through the face and body, bloodletting rituals, and it is all about fulfilling vows, symbolizing penance, gratitude, and spiritual strength. And this has been practiced there for thousands of years, and it's a very, very beautiful festival. A lot of folks do, in particular, pain penance, which is very common all across India and Southeast Asia, where once a year they consent to these pain-focused rituals, walking on coals, walking on broken glass, piercing the skin, tattooing, as a way to apologize for sins of the past year, to ask for blessings for the future. In preparation for this, they fast, they meditate, and many people who participate say that they enter a trance state where they don't feel pain. Their wounds are documented to heal unusually quick and well, and it's a celebration. The people who are doing this are beloved by the people, the community around them, because oftentimes those who do choose pain penance end up taking on the sins of the community, or taking on the sins of the family, or asking for family or harvest or community blessings. And it's a very beautiful ritual, and it also is pain as medicine. I'd like to show some photos from this. Content warning because some of them are a bit graphic. But this is someone who has some piercings in the forehead and spear through the cheek for the processional. You'll see a lot of people practicing like this at Taipu Sam, but part of this is a larger, more intense ritual. So we also see large insertions in the cheeks, sometimes of swords, large spears. They can be objects relevant to a person's trade or life or family or sacred objects. In these images, these are piercings being done at the Chu Tui Shrine. And my friend Chase Campbell is the person stabilizing these participants' heads as they're receiving these piercings. And what we're witnessing and getting to glimpse in these photos here is an incredibly high honor amongst people who are attending this festival. So pain as medicine, pain as community coming together and asking for thanks and forgiveness in the new year, and pain as celebrating good over evil. And for the people who are practicing it, the power of the spirit over the body, with some really, really beautiful cultural meanings. Other cultural pain practices that we see around the world, the Maori practice tamoko, which is a sacred spiritual rite of identity marking and ancestry through tattooing. Chisels are used to carve deep grooves, not just with ink, sometimes with scars. And there are strict rules around what you participate in while you're receiving the tamoko. Enduring the pain of it is considered a sign of strength and mana or respect and power. And then you wear these cultural signifiers of your life, your history, your ancestry on your skin for people to see. Sometimes tattooing is even done as part of funeral ceremonies to process grief for people who have passed and people who have been lost. Christianity, that's what I grew up in. And so this is one of my favorite things to talk about because people like to assume that Christianity and some Western religions don't have that. Mortifications of the flesh are a fascinating piece of Christian history. We're removing sin from the body and imitating Christ's suffering. So self-flagellation and whipping yourself, they still do this in Spain around Easter time. Self-flagellants walk through the streets whipping themselves, and breaking the skin with it to offer penance and emulate Christ's suffering, and express thanksgiving. It can be done privately or publicly. Christians also got weird with it. They wore hair cloths, and intentionally scratchy and uncomfortable undergarments that you wore every day to resist the sins of the flesh and to offer penance to God, or the spongia. They would take hard rounds of cork filled with needles and nails, and you would beat yourself in the chest, also usually as part of a festival and an offering to God. Here in North America, we have the Plains tribes who often practice the Sundance ritual, which is characteristic primarily of buffalo hunting tribes. And it's an 8-day ritual that the entire tribe participates in, culminating in the gazing at the sun dance, which is a body suspension or flesh hook ritual, which is designed to bring warriors into a new chapter of their life and also strengthen community ties through ritual like this. And we're going to peek at a couple photos of some sun dances provided by the First Nations Hook Collective. Both of these are attributed to the Lakota tribe, and we can see here we have some hooks in the chest, and we're pulling against them and then dancing with hooks in the chest. And just a really incredibly beautiful ritual that was at the center of tribal connection, of coming of age, of entering adulthood, and marking that in a way that everyone saw and knew that you were ready to be a warrior of the tribe and ready to be an adult in the tribe. And then all across Sudan, tribal scarification is a very, very common practice, and also in Sudan, one of the oldest practices. Scars denote tribal relationships, career, marriage, feats of strength, and also can be punishment for cowardice or used to denote slaves. If you were, sent to lead a war band and you ran from the fight, you might get scarred for cowardice. But if you pulled off a feat of strength or completed a difficult hunt, you might be rewarded with scars that told that. And so together the tribes would gather, people would be cut, usually with sharp stones and bone implements, and we would share in pain together and celebrate either what they had achieved, denote their history, or sometimes punish people. But all across the world, almost every single culture has some dabbling of pain ritual or pain as medicine. Whether that culture presently wants to acknowledge that or not, Christianity, this is just an innate human thing that we are doing across cultures and across time. And so, also from Favazza, from Bodies Under Siege, one of my favorite quotes. Indeed, travelers to India cannot help but be impressed by the number of aesthetic holy men, some of whom appear wasted and who twist their bodies into odd positions to free themselves from the bondage of worldly objects. What is puzzling is Indian psychiatrists rarely report instances of self-mutilation as a result of mental illness. One explanation is that in India, self-mutilators are not viewed to be in need of psychiatric treatment. Another explanation is that there are social groups and religious festivals in which persons given to self-mutilation are well accepted. Favazza wrote this book back in the 80s to 90s, and spoke a lot about the fact that you just don't see a high report rate in India of self-mutilative behaviors, despite the fact that once a year people are putting machetes and spears and objects through their cheeks, because this is a culture where this type of pain penance is well understood and well practiced, and where physical pain is not viewed in the same intensely negative lens that we see it in Western cultures. Yeah. So in the West, body modification is pathologized. All across our country and across history, body modification has been pathologized in the West. This disproportionately affects queer, BIPOC, and women who may face extra cultural and systemic scrutiny for being modified. Things like losing custody cases, being denied medication, and being refused job offers due to modification are sadly common. So the Code of Indian Offenses was passed in the mid 1800s, and it was designed to assimilate Indigenous Americans into the culture, but it made things like medicine man practices, suspensions, tattoos, piercings, and scarifications illegal. In fact, that code wouldn't be repealed until the 90s. Sailors had tattoo studios and could get tattooed legally in America, but Indians would have rations withheld per the Code of Indian Offenses if they practice those same tattoos and piercings. So very early on, we created a hierarchy of who could get what, and we quickly portrayed tattoos and piercings and suspension as this othering thing and this savage thing, quoted directly from the Indian Offenses Code, and we made them illegal. And that mentality bleeds over into today. We see it with assumptions that modified patients are drug seeking. This is a common problem in the tattoo and piercing industry when tattoo artists and piercers who are very heavily modified get into a car accident or break a limb or something happens and they go to the hospital. There's mountains of evidence within our community of being denied painkillers, being denied care, or not being believed about the levels of pain we're in, and being labeled as drug seeking purely for being modified. And a lot of that comes from mentality that tattoos have a gang affiliation. Lombroso, one of the voices that was integral in keeping the Code of Indie Offenses around for so long, said that people who get tattoos and piercings are born criminals. And if you have them, it shows that you are inclined towards crime. We saw this in the feminist sex wars of the 80s and 90s when there was a lot of inter-community struggle surrounding things like leather and leather dykes in particular, and a demonization of S&M sex acts throughout the feminist movement, and especially throughout lesbian spaces. We see that modernly in septum ring theory, which you can see on TikTok, which is this concept that people with septum rings, particularly feminine presenting people, are blue-haired liberals and not people worth listening to, and this concept that a septum ring devalues you. All of that we can trace back to things like the Code of Indian Offenses, and mentality that things like tattoo and body modification are unclean or savage or negative. And we see that spill over into therapy spaces as well with prejudgments about these patients. I've seen medical texts that actually teach that if a client has piercings or a patient has piercings, you should be skeptical of their bloodborne pathogen status. That has been in medical textbooks for doctors to learn from as recently as 5 years ago, which is wild. So we see linked to colonization, linked to white supremacy, linked to an attempt to erase indigenous cultures, this pathologization of these traditional practices. But despite this, none of that has stopped people from practicing all of these things. None of that has stopped people from getting tattooed or pierced. They did not manage to eradicate the Sundance despite their best efforts. Taipu Sam still happens all of the time. Tamoko is under a resurgence in Aotearoa. People are still practicing all of these things, even though they're very painful things. And to that, I come to this quote constantly from Lee Cowart: "I feel bad so I can feel better." It is generally understood that endorphins feel good and they get you high. You see, endorphins is a portmanteau of endogenous and morphine. The drugs are coming from inside the house. When I talk about feeling bad to feel better, I mean it very literally. So we're going to take a tiny detour into an understanding of pain processing and how pain works. Because, of course, we know all these cultures are doing these very interesting pain rituals. We know they have a very big cultural component in many places, but what is actually bringing people back to rituals of pain? Why 1,000 years ago were we bearing the kavadi and doing cheek spears for Taipu Sam, and why do we still choose to do it today? So, a very quick, brief overview of pain processing and pain systems. Transduction is the first portion of pain processing. Damaging stimuli trigger nerve endings to send electric signals up through the body. These signals travel the spinal cord to the thalamus, and then the thalamus is a relay station for these signals and sends everything where it needs to go, which is our relaying and routing. The thalamus receives these signals and, like a switchboard, passes them out. Primarily, we're going to the somatosensory cortex, which is determining pain location, intensity, and type. Is it a sharp pain? Is it a dull pain? Is it hot or cold? Once this is happening from the somatosensory cortex, we take a look at the limbic system. This is processing the emotional response to pain: fear, anxiety, fight, and flight, and its links to memories. A person's lived experience, past pains, trauma, and emotional state all influence their experience of pain. Pain is subjective. From there, the prefrontal cortex integrates sensory input with thoughts, expectations, and context to form that overall experience of pain. Each individual human may have a different response to the same pain and may respond to the same pain differently in different circumstances. So, Again, very subjective in terms of pain and how pain works. And then lastly, modulation. The brain can respond to pain signals and either block or amplify them, including the use of endorphins and other natural neurotransmitters. So something happens to cause pain, those nerve endings send that signal up to our brain sorts it. Some of it goes to our somatosensory cortex, and some of it goes to our limbic system. We process how we want to respond to it, and we incorporate our own lived experiences, our pains, our traumas, the situation we're in, and then our brain determines how it wants to respond to the pain each time. So, pain is a subjective experience. It's informed by emotion, memory, past and present, culture, and even language. Some languages have dozens of words for the same type of pain, and some languages have no words to describe the same very hyper-specific type of pain. It's totally subjective based on our lived experiences. Um, Pain has been traditionally understood as purely physical in nature, but it is more accurate to describe it as the intersection of body, mind, and culture. As someone who works as a professional piercer, I see this all of the time in the piercing room. I see people who are absolutely terrified to get a shot at the doctor's office, like crying, need someone to hold their hand, need someone to sit, will get lightheaded, will likely pass out, need sugary drinks, very tough time with it, come into the studio and hop up on the table with a smile on their face, ready to get a piercing, no nerves whatsoever, super stoked, even though arguably it's a very similar sensation both times. What's happening is the context their body is framing that pain in. The piercing is an active agency. They're choosing to be there. They're excited about the end result. There's no other, like, medical rooms and situations can sometimes be triggering or overwhelming for stuff. And for a lot of people, there's none of that. There's not no clinicalness because modern piercing is very clean, but there's a lot less of that clinicalness. And so in that situation, they feel safe and they can manage it. And we see this play out in pain rituals all around the world. Chase, my friend who goes and participates in Taipu Sam, says some of the men who do these incredible feats during the festival, the rest of the year are like, it's cold. I don't want to go outside. Oh, that seems like a really long hike and a really far walk to do all of this. And he's like, wait, I put a machete through your cheek 3 months ago, and now you're worried because it's a little chill in the air. The cultural presence, the support of their people and their community, the thousands of years of ingrained cultural memory surrounding the ritual, all of these change the way we process pain with that. And tattoos and piercings very much can do the same thing for people modernly. And allow us a safe way to explore pain and pain-based experiences and have that control over our pain. So, what does this mean as providers? For me as a piercer, for you as a therapist, how do we need to consider that? Patients may seek release of relief in pain-based practice or rituals, and these practices are not black and white, good or bad, healthy or unhealthy. In having an understanding of the history of these practices, the potential benefit, and our individual patient, we can hold space for the benefit that pain-based ritual can have while also steering people away from genuine harm. I don't want to pretend that people don't use these practices as a way of self-harming or self-mutilating, but I think limiting these practices to just help self-harm or mutilation flattens a really long cultural history of pain medicine and pain practice around the world, and also limits our ideas of what coping and healing can look like and what embodied experiences can look like. For me as a professional piercer, I get to work with people day in and day out and see people in these vulnerable moments of pain and also see the healing that these consensual moments of pain can provide for folks.
We have some people in the chat saying the difference between going in for body modification versus going into like a medical setting feels really descriptive for their experience. One of our members, who's also a psychiatric mental health nurse practitioner, mentioned that the context is huge here. Like getting a shallow needle is very different than like a subcutaneous, intramuscular, or intravenous poke. And then seeking out the poke of a tattoo versus the poke that happens to you medically can also be like a huge difference there.
A huge difference. I was the person growing up who hated getting shots and hated getting anything. And I remember having to get like held down still at the age of 13 by nurses to get a shot done, but was totally fine cutting myself in the privacy of my own home where I was in control and where that felt like a totally different environment to experience that, even if objectively cutting myself was way more painful than a tiny little flu shot or vaccine at the doctor's. All of these things are so subjective with it. And yeah, it's very like the place that the pain is occurring and how it is occurring and our say over it are very important as well. This leads beautifully into this another quote from Lee Cowart. This is particularly important in the context of people who have a history of trauma where choice was taken away from them. Directly affirming control over a potentially painful situation enables each patient or playmate to know that fundamentally they hold the power. And another one from Cowart, consenting to pain directly and on purpose has been an enormous influence in my life. It is the consent that makes the healing possible, and what I seek cannot exist without it. A really important through line of all of the rituals we've talked about and all of the practices we've looked at is that they're all extremely consensual. People are choosing to do this, and not only are they choosing to do it, they're choosing to do it with the love and the support of people around them. In cultures where pain rituals are still practiced or were practiced, it's with not only this person seeking it, but all of their friends, all of their family members, and their community at large, creating a structure where they can safely experience consensual pain. We lack that in modern Western culture. Pain is something that we think has to be solved by a doctor or a medical professional. Physical pain should be medicated away with some pills or some painkillers, and emotional pain should be stamped out in therapy offices. But pain is an essential part of living. Pain is an essential part of being human and the human experience. And I think when we completely reduce pain to something to be medicated away or removed, we do ourselves a disservice of experiencing the full breadth of humanity. Pain, like every other emotion we experience, has things to teach us and has things we can learn from it and has benefit it can provide. When we think about the actual scientific nature of pain, the sections of the brain that process physical pain and emotional pain are neighbors. They're right next to each other. So when the body decides to send an endorphin response to a pain, those endorphins end up flooding that whole area of the brain. So if you are feeling very emotionally overwhelmed and activated, maybe you're that person who just got dumped and broken up with, and you're feeling all of those feelings, and you decide to come in and get your nipples pierced. We do that piercing, and you get that endorphin rush in your body, and those endorphins go to both sections of your brain. And suddenly, the part of your brain that was so overwhelmed with the breakup and feeling this grief and this loss and this anger and this resentment is also getting a big healthy dose of endorphins and helping it calm down and helping it process that. And clients end up leaving the piercing studio feeling more in control of their self, feeling more calm, feeling more regulated. For that moment, they were in their body. We were doing some breath work as we were piercing. And that consent to pain is something that allows a lot of people to explore healing and to find more control over their body. So, consensual pain can be so empowering and so healing.
Yeah, someone else in the chat that said this can really help as a reminder that emotions are temporary too.
Mhm. And pain is temporary as well. And like the fact that I have gone through so many painful experiences, particularly physically painful experiences, being pierced or tattooed, I draw on that when I deal with emotional pain. I got news of a very close friend's passing a couple years ago at work, and I remember feeling this moment of like intense overwhelm. I was like, how am I going to work the rest of my day? How am I going to do any of this? It was a day that was hard for me to have left work early. I had clients relying on me. And I paused for a moment and I said, if I can breathe through 8 hours getting my kneecap tattooed, if I can breathe through hanging from hooks in my skin, if I can do all of these things that are painful and difficult and impossible, I can breathe through this pain too. And I know what it looks like to access getting through a tough spot of a tattoo or working up the nerve to get a piercing I'm scared of. And I am confronting that pain the same way I'm confronting my grief in this moment. they had not had the best relationship for most of their lives together. And we were, we're coming up, we're trying to reconnect, trying to heal an adult relationship. And mom made the big decision to decide to come get a piercing with their child and was terrified coming into the studio to get her ear pierced. Was so nervous, but so sweet. But was like, if my child has put up with all of these difficulties and hardships we've had in our relationship together and all the emotional pain I have inadvertently caused, I think I can manage getting this piercing and having this bonding moment with my child and showing them that I'm showing up for them now, that I care for them now, and this physical reminder that I love them, that they love me, that, we can heal what is happening here. And it ended up being this beautiful bonding moment. I'm pretty sure the child did not think mom was going to go through with it until the moment it actually happened. But it was really beautiful to get them share that space of vulnerability together, and be in pain, even temporarily together, and see what that taught each other about what they're capable of and about how they can process things, and also how healing that must have been for the child to see the mom not just say that there were going to be differences or changes or connection, but like put her body on the line, and show up for that. And it was beautiful. The smiles on their face get me every time I revisit these photos. And it was just such a magical experience to get to be a part of. And when we just look at it on paper, parent and child consensually get stabbed to fix relationship. Um, a lot of modern Western lenses would go, that's maybe not something that we should be doing. Or maybe that's like something we can use to cope right now, but not the healthiest of coping mechanisms. I look at this as an incredibly healthy coping mechanism, with basically next to no negatives as long as you're prepared to actually heal a piercing. Because I think consensual pain, and consensual, I use the term blood ritual, but anything that's breaking the skin has a place and can be really healing and can be really empowering. So my perspective as a piercer is to talk to patients about their goals and experiences with modification, encourage them to explore what they get from the process, and help them connect with the deeper subconscious experiences that can happen with that and validate their healing. I won't pretend that every potentially self-injurious behavior can be healthy or can be healing. I do see people in my line of work who use piercing or tattoo and, of course, cutting and burning as self-injurious behavior. But I find more often than not, what we would typically label as a self-injurious or self-harming behavior is really colored by that Western lens and that historical view of these practices, and sort of eliminates this rich cultural history of pain as medicine, and pain ritual and pain healing. And I wonder what it would look like for us to have a modern society where there were safe community ways for people to explore pain like this, like we see at the Thaipusam festival, like we see with the Sundance ritual, like we see with getting tamoko done, what it looks like to encourage pain as a normal and acceptable part of the human experience, and to come together and support people in allowing their bodies to take on part of the load of processing their emotions.
We had a lot of people sharing things in the chat with this part. Someone said, thank you for that example. It reminds me of when my close family friends all got matching tattoos with their dad when he was close to transitioning from life. They also said, I work a lot with people who have chronic pain and chronic conditions, and this makes me curious about how people may use this to manage that kind of chronic ongoing pain. Someone else said,
I
I have,
want to touch on that
yes.
one before we get too hard. Chronic pain conditions are incredibly common, specifically in the body suspension community, which I find really interesting. We have a lot of well-known practitioners with fibro and lupus and EDS and all sorts of daily chronic pain condition who speak a lot about how choosing their pain and choosing what their body is going to experience that day is incredibly empowering and freeing. And also the altered mental states they achieve through things like body suspension and pain-based ritual can help regulate them for months on end afterwards. I think of one particular peer of mine who has spoken very publicly about this before, who struggled with incredibly debilitating migraines as a side effect of her worsening EDS as she aged, and did a suspension probably like almost 20 years ago now, and found that between the endorphin rush and the adrenaline and how present she was in her body and the way she moved her body during it, she ended up not having migraines for a few months afterwards. And for the last 20 years, she has been doing a suspension every couple of months because it resets her nervous system, it re-puts her back in her body, it reminds her what it is to breathe through pain and process. And she says she doesn't deal with the migraines nearly as frequently anymore. Now, she is based in New Zealand and has had an interesting experience finding healthcare professionals who will still work with her with this as a part of her practice. But she says more so than most of what she's experienced, like even in therapy, and even in like professional medical spaces, suspension and consensual pain ritual has done more for her, for helping her with her daily things, and helping her feel confident in her body. And something about the endorphin rush, and again, like that altered mental state she achieves, just really calms those symptoms a lot. But we see it all the time. There is definitely a strong connection between people who experience chronic pain conditions and wanting agency over pain and exploring pain-based ritual as a way to find that agency and control in pain.
Do you want me to share other comments or would you like to keep going? Then we can review at the end.
Yeah.
Share now or should I wait?
Yeah. Yeah.
Wait.
Share them now. Sorry.
Oh, share now. Okay.
I was like, yes,
Okay,
yes, share now.
so someone has said I have fibro and people do use body mods sometimes to manage chronic pain, at least in fibro spaces. I've read a lot about people getting short/midterm pain relief, and I think being able to choose pain, like you said, is helpful in coping with the chronic nature of it. Someone else replied to that and said I was recently diagnosed with fibro, and so I'm new to this. I keep forgetting that this includes me. And then it sounds like they're going to connect. Someone else said, I learned how to use creating sharp sensation in my control, like squeezing a comb during my unmedicated labor and childbirth, which helped me a lot. And I now use it when I have to have a painful medical procedure like dentals, procedures, needles, mole removals. And I've recommended it to clients, and people were like, yes, I agree with that. I've seen some spiky stems used and
Yeah.
available online for people. Yeah, and it keeps going. So I'm going to pause here and then we can review at the end.
I see one about a little one getting their first earlobe piercing, and I just want to read through this because it reminds me of the mother and daughter that are here right now. Yeah, it is super connecting. So that's something that I love talking about with piercings too, is that they're long healing wounds. So tattoos, in my professional experience, tend to have this big onset of endorphin and adrenaline response when people are getting the tattoo, and they have a shorter healing time period, about 2 to 3 weeks for most folks, and after that they're healed and we return to it. And so you have this big endorphin rush during the tattoo that can really help with emotional regulation and embodiment. You have this time period of healing and rest, and then you're able to kind of resume your daily life and see the benefit from that. Whereas piercings, you get it done and then they take months and months and months to heal. So they required this longer embodied experience of healing. And as a side effect of having a healing piercing, having to clean that every day, having to check on that body part every day and make sure things are doing okay, and having to kind of be kind to that part of your body. And in particular, as someone who does a lot of genital piercings, I see very frequently the moment of piercing is a moment of empowerment and strength and particular vulnerability, especially for survivors of sexual trauma. But the biggest healing occurs during the healing time period. And the biggest takeaway I've seen from clients, particularly folks with vulvas, is when we have internal genitalia. I think it's a little bit easier to pretend that that genitalia is not there and not really see it or interact with it. Whereas when we have external genitalia, there's kind of no avoiding that it's there. and we have to deal with it all the time. So for folks with vulvas, it can be very easy to sort of pretend that that part of our body isn't there. And I see a lot of people report that the process of healing a genital piercing is the most that they have visually examined the area in most of their life, and the most they have interacted with the area in a non-sexual manner. Because for a lot of folks, we wipe, we do our business, we get rid of stuff, but we're not really looking, checking, touching, interacting. And when we are, it's either because something is wrong and we're like, where is this ingrown hair that I know that I feel? Or because something sexual is occurring, whether it's by ourselves, with partners, or something else. So when we're getting a piercing and we're healing it, it sort of unlocks this new third option of neutral interaction with that part of our body and kind and non-judgmental interaction with that part of our body. And so many clients reach out to me and they're like, the piercing was really empowering. I'm like, glad I got it done. It's functional. I was not expecting how emotional healing it was going to be for me and what it would mean for me to have to look at this part of my body and clean it and care for it and be present with it over the course of months, and what a new relationship that has given me with this part of my body that I usually just kind of pretend doesn't really exist or isn't any of my business.
Yeah, someone else said, I don't understand how I have insurance that pays for me to get acupuncture, which is many needles in my body for an hour, but having more than one piercing in each ear is pathologized and is not allowed if you want to work in medical systems.
hmm Which is super interesting when we think how many cultures have ear piercings as a potentially medicinal practice, or pain-based ritual as a potentially medicinal practice. Once again, all across India with historically low rates of reported self-injurious behavior, piercings are considered medicine, and it is socially acceptable to go see the eye doctor and figure out glasses and things like that, and then also go see the piercer and get your ears pierced in a certain way and wear certain jewelry to hopefully achieve better vision or good luck with these things. Medical systems have a history of wanting to control bodies, 100%. And that sneaks into training and education and manuals and even like our own judgment systems more than we realize. Even working as a professional piercer, I sometimes have to catch myself where I have to remind myself that it's my client's body, not mine, and I'm here to steer them in a safe direction. But sometimes the emotional healing that they can get from piercing is more important than some of the physical risks. Um, when I think of this, I think of in particular, this whole class is a content warning, but I'm going to have a second content warning right here. I worked in Florida in Coral Springs during the Parkland massacre on Valentine's Day. Um, getting close on like 7 or 8 years ago now. And multiple of the victims were clients of mine, and many survivors who were present in the school for were clients of mine. And I saw an extreme influx of students who were there and also parents and community members coming in to get tattooed and pierced afterwards. And in particular, a lot of the students who were experiencing trauma were coming in maybe too frequently to get new piercings for what would be safe for their body to heal. But I ended up speaking with some of the family members and even some of the therapists who were talking about the fact that like the pain and sensation of the piercing was very healing. The need to be present in their body for care was, for one student, the only thing getting her parents to get her to take a shower, was reminding her that she had to take care of this piercing that had to heal. And we ultimately, together, all three of us decided to do maybe more piercings than is reasonable in a short time frame, understanding that there were some physical health risks there of not necessarily infection, but scarring, but the emotional benefit to the child was so great. And each piercing was this sense of agency over their body. And the process of healing was one of the few things getting them to practice self-care, to brush their teeth, to get out of bed, to work on stuff, to regulate. And over the time period of a couple years, I watched one student in particular go from never making eye contact, never really talking directly to us at the studio after the shooting, to coming in and coming up to the counter and greeting me and telling me what they wanted to get done that day, and talking to me about how their piercings were healing, and just interacting more with other people, and got to see firsthand how instrumental creating a space that we made safe, that her parents validated as safe, and that the therapist supported made a difference, very direct difference to what healing looked like after surviving something as terrible as a school shooting. So it's just such a beautiful way of coping that to me makes sense historically when we look at how many different cultures have explored altered mental states through pain and pain ritual, and how many different cultures have incorporated this as a normal part of the human experience. And when I consider the scientific side of things, and I look at how pain processing works in the body, and I look at how endorphins and adrenaline work in the body, it all to me makes perfect sense why we experience healing and release from these things. Um, and so, if there's anything you can take away from this, it's to look at all of these practices with nuance. If you do encounter a patient who you worry might be using body modification or tattoo in an unhealthy way, or if they're using it in a healthy way and you want to be able to show up for and affirm that, taking the time to learn about cultures who practice these things and information outside of a Western therapy lens into the benefit of these practices and the history of these practices, and also a good understanding of pain processing and how we deal with pain in our bodies, and how physical pain and emotional pain are so perfectly interlinked, and the ways that one or the other can help heal both. And that's at the heart of what I get to do every day as a piercer, which I think of really cool. And also that healing is the heart of what you all get to do every day, and showing up for people with that. For folks who want to explore more about these subjects and learn more, some really good books that I would recommend and resources. Hurt So Good is The Science and Culture of Pain on Purpose. We read a lot of quotes from the author Lee Cowart today as part of this seminar. She looks at variety of pain-seeking practices from a BDSM and kink lens herself, but she looks at extreme sports such as ballet, where people are breaking their toenails together to dance. She looks at things like body suspension and tattoo and piercing, ultra marathons where people are pushing their body to the limits, running, as well as cold plunges for regulation, and people who eat extremely hot peppers. And does some really cool interviews with people who eat extremely hot peppers about the types of emotional regulation they feel like they get from experiences of intense spice. And it's a great introduction. She interviews a lot of neuroscientists as well and really explores it from the perspective of what we get out of painful experiences in our brain. We also looked at a lot of quotes from Armando Favazza, Bodies Under Siege, Self-Mutilation in Culture and Psychiatry. This was published in the 80s, and it does read like it was published in the 80s. So take that with a grain of salt should you decide to read it. I think it is great. And for the time period it was published, I think it was incredibly progressive. And the large takeaway from that book is that a lot of what at the time was blanket labeled as self-mutilation could have a lot of healing and a lot of benefit for people, and a very nuanced look at these different behaviors and what they might mean for the person exhibiting them. Sacred Pain, Hurting the Body for the Sake of the Soul is a really great book by Ariel Guglick that explores pain rituals across different cultures and what we can gain from pain rituals, and particularly takes a look at some interesting Muslim writers and mystics who believed in pain processing as an innate part of the human experience. Very cool to learn some of the historical stuff. Safe Spaces, Sharp Objects is a book that I published last year, about trauma-informed care in the piercing industry, looking at the linkage between trauma survival and body modification and tattoo and piercing. It's designed kind of to be a workbook for piercers to be more trauma-informed care, but it does include a lot of good information about why statistically we see an overlap between these things and what it can help with. And then The Culture of Pain is another good book series to check out about this if you want to dive a little bit more in depth. And then thanks.
That was amazing. Thank you so much.
And then I'd love to dive more into any like questions or other things people have. Ah, thank you. Thanks for
Lots of
having me. Oh, yeah.
gratitude. Mm-hmm.
Totally understand having a client. I'll be running to grab clients in an hour or so after this.
I'm thinking I'll stop the recording in case anyone has questions that they would not like on the recording.